اليوم هو المؤتمر العلمي الطلابي الثاني لطلاب كلية الصيدلة جامعة الزقازيق. المؤتمر بيبقى الأساس فيه إنه بيبقى فيه ندوة علمية ثم برزنتيشن لبعض الأبحاث الفائزة المقدمة من الطلاب. يتم تكريم الثلاثة الأوائل الفائزين من الأبحاث اللي هيتم برزنتيشن عليها عقب التكريم مباشرة.
المؤتمر هيتضمن جزء بحثي اللي هو عرض اللي هو الريسيرش ساينتفك ريسيرش او ابحاث طلابيه علميه، هيتناول فيه اللي بيعرض برزنتيشن ومناقشه وحوار. فده جزء اخر من تنميه الشخصيه الطلابيه ومتطلب لاثقال المهارات اللي هي بنسميها الترانسفيربل سكيلز او اللي هي المهارات المنقوله. فده متطلب ايضا ان الكليه تنميه في الطلاب.
بسم الله الرحمن الرحيم. I'm Ocular first year student, Faculty of Pharmacy at Zagazig University. This is a presentation for a review study entitled The Role of Traditional Herbs Used in Alzheimer's Disease Treatment in the Management of Ocular Pathology. So throughout this presentation we are going to talk about the pathogenesis of both Alzheimer's disease and the ocular pathologies. And then we are going to talk about the mechanisms of herbal extracts and their relation in treating both Alzheimer's disease and ocular pathologies. Then we are going to mention the study objectives, the methodology used in order to present this study, and then we are going to have a quick review about the traditional herbs that are included in this study, and finally we are going to mention the conclusions and the recommendations.
هو المركز الأول أفضل رضا وممتاز جدا جدا. كل حاجة هي تعرفه في الأيتمز اللي عملها، والثقة في النفس في الصور، اعتمد على صور أكتر من كلام يعني. فمشكور جدا
قواعد التقييم في الكتابة ولابد ان يكون منتهي ريفرنس ولابد ان يكون في تجميع من أكثر من مصدر. بعد كده طريقة العرض والبرزنتيشن والباوربوينت، اللغة، الثبات، قدرتك على التفاعل مع الجمهور، كل الحاجات دي أعتقد بيبقى فيها نوع من الفاريشن ما بين بعض.
بسم الله الرحمن الرحيم. I'm Ocular first year student, Faculty of Pharmacy at Zagazig University. This is a presentation for a review study entitled The Role of Traditional Herbs Used in Alzheimer's Disease Treatment in the Management of Ocular Pathology. So throughout this presentation we are going to talk about the pathogenesis of both Alzheimer's disease and the ocular pathologies. And then we are going to talk about the mechanisms of herbal extracts and their relation in treating both Alzheimer's disease and ocular pathologies. Then we are going to mention the study objectives, the methodology used in order to present this study, and then we are going to have a quick review about the traditional herbs that are included in this study, and finally we are going to mention the conclusions and the recommendations. So the first thing that we are going to talk about is Alzheimer's disease. What's Alzheimer's disease? Alzheimer's disease is a progressive neurodegenerative disorder and is characterized by the formation of senile plaques of beta-amyloid peptides accumulations. These occur in the area of the brain called the hippocampus, and accordingly they lead to memory loss. Interestingly, it was found that actually the mechanisms of retinal pathologies like glaucoma include the formation of the same beta-amyloid peptides that occur in the brain and the optic nerves like carotid nerves and so on. And this causes oxidative stress and accordingly, glaucoma occurs and the vision decreases until it reaches blindness. As we can see here, this is a protein, and this sequence of the protein is the beta amyloid. Now, a disorder occurs, so the production of the beta amyloid increases until it causes these plaques that causes neurodegeneration. Then, the mechanisms of herbal extracts. Herbal extracts, the interest in herbal extracts, of course, increased recently in treating a very large number of diseases, like Alzheimer's disease. And accordingly, the same interest was given to treating ocular pathologies like retinal pathologies and glaucoma, because they have a very good profile of antioxidant effect, and relieving this oxidative stress may actually improve the cases in neurodegenerative disorders like Alzheimer's disease and glaucoma. Why did I make this study? It was a review for preclinical and clinical published articles about different herbal extracts used in the treatment of Alzheimer's disease that can actually be used in the management of ocular pathologies. Thorough search was conducted through libraries, online libraries like Science Direct, Springer Link, and PubMed, and the criteria that the studies included in this review study were that the disease was a retinal pathology and the herb was a herb used in treating AD that had a role in treating ocular pathologies, and these are ginkgo biloba, ginseng, wolfberry, saffron, and ganoderma lucida. Now this is a quick review for the traditional herbs used in the treatment of AD that have a role in treating ocular pathologies. The first one is ginkgo biloba. This is a very famous ancient Chinese herb used from very ancient times in treating age-related diseases, and it was tested clinically and pre-clinically in randomized double-blind placebo-controlled trials in humans that it relieves oxidative stress and yields good results in improving cognition in Alzheimer's disease. And accordingly, the hypothesis was there that it can actually help in relieving oxidative stress in retinal pathologies, and it actually yielded positive results. The next one is ginseng, and here we have two varieties. We have Panax ginseng, and we have a Brazilian variety called Fafia paniculata. The Panax ginseng was tested, and it improved on normal persons. It was tested on normal persons, and it showed that it can relieve the oxidative stress and improve cognition in patients. And then this Fafia paniculata variety had positive results in relieving the oxidative stress in the retinal pathologies. Because the ginseng actually mainly has like 30 ginsenosides, and they all have good effects in relieving oxidative stress. And specifically, the ginsenosides RB1 and RB3 in this variety helped in improving the glaucoma cases. Next, we have the Chinese herb Lycium barbarum, which is also called the wolfberry. This one was known from ancient times that it actually treats eye pathologies, and it was tested preclinically on rats by inducing retinal ischemia, and it showed a very good profile of improving the action of microglial cells, and these of course increase the connection between neurons, helping in decreasing the rate of neurodegeneration. So it yielded actually positive results, and of course it was used before in the treatment of Alzheimer's disease throughout a milk-based extract that it was provided to the rat models through the memory glands. So the next one is saffron, or Crocus sativus. This one is used in the treatment of Alzheimer's disease, and it shows very, very good results compared to the chemical drug Dompeziel that have a very wide range in the market in treating Alzheimer's disease. Saffron has an extract called crocine and crocetine, and both of them were used in treating retinal pathologies, especially glaucoma, and they showed a very good profile of neuroprotection and the prevention of ganglion cell losses that when happening in the retina, glaucoma occurs. Finally, we have the Ganodermal acidum, and the Ganodermal acidum, the spores of Ganodermal acidum has its effective ingredient, and it actually shows also a very good profile of neuroprotection and ganglion cell loss prevention. So from all the previously mentioned facts, we can conclude that herbal extracts seem to offer a promising hope in the treatment of both Alzheimer's disease and retinal pathologies, especially glaucoma. And this is through expressing good profile of retinal neuroprotection, prevention of ganglion cell loss, and photoreceptor cell protection. From these results, we can actually recommend some recommendations here, that the close relationship between Alzheimer's disease and ocular pathologies, especially glaucoma, should be used in a very good way, because research should be going on both ways, doing a double research. So applying using herbs or extracts of herbs on ocular pathologies and Alzheimer's, and finding out what would result in both cases and making use of it on the other disease, and also making use of the advantage that the mechanism of both diseases are nearly the same, so explaining the mechanism can work out through both diseases. And finally, more attention should be driven to the exploration of mechanisms of both Alzheimer's disease and ocular pathologies, because the main point that we are talking about here is the precipitation of beta amyloid peptides, and the main cause of the precipitation is still